Bon après-midi, tout le monde, et bienvenue à cette mise à jour. Good afternoon, everyone, and welcome to today's update. Speaking on behalf of the province today in the following order are Dr. Jennifer Russell, the province's Chief Medical Officer of Health, and the Honorable Dorothy Shephard, Minister of Health. Les paroles aujourd'hui dans l'ordre suivant sont la médecin hygiéniste en chef, la Dr. Jennifer Russell, et le ministre de la Santé, Dorothy Shephard. Dr. Russell.
Thank you, Bruce. Merci. Good afternoon. Bon après-midi à toutes et à tous. Hier, le Nouveau-Brunswick a enregistré le plus grand nombre de cas de COVID-19 en une seule journée depuis le début de la pandémie. Je comprends que le fait d'apprendre qu'il y a eu 174 infections en une journée pourrait être alarmant pour bon nombre d'entre vous. J'avoue que je suis moi aussi préoccupée par ce chiffre. Notre situation a cependant changé au cours des récentes semaines et Santé publique ne croit pas qu'il soit nécessaire d'imposer d'autres restrictions à la population du Nouveau-Brunswick pour le moment. Les directives et les conseils présentement en place suffisent pour atteindre l'objectif de notre plan d'action pour l'hiver, soit protéger notre système de santé tout en minimisant les répercussions de la pandémie sur la vie quotidienne des citoyens de la province. Yesterday, New Brunswick recorded the highest number of COVID-19 cases in a single day since the pandemic began. And I understand that seeing 174 infections reported in one day would be alarming for many of you, and certainly I am concerned with these numbers. Our situation has changed in recent weeks, and public health does not see a need to recommend further restrictions on New Brunswickers at this time. The guidance and advice now in place are sufficient to meet the objective of our Winter Action Plan to secure our healthcare system while minimizing the impact on the everyday lives of New Brunswickers. It is true that we are seeing a spike in new cases of COVID-19 in New Brunswick. A large proportion of these new cases, particularly in the Fredericton area, have been reported in children and teenagers. And I am a mother, so I do understand how distressing this is, especially for the families of these children. Aujourd'hui, Santé publique annonce qu'il y a 143 nouveaux cas de COVID-19 au Nouveau-Brunswick ainsi que 63 rétablissements. Nous avons malheureusement un autre décès à annoncer, soit une personne âgée de 70 à 79 ans, résidant dans la zone 7, soit la région de Miramichi. Nous signalons en moyenne 109 nouveaux cas tous les jours depuis une semaine. Ces nouveaux cas se trouvent en majorité dans la grande région de chacune des 3 plus grandes villes du Nouveau-Brunswick. De plus, les enfants et les adolescents forment une proportion élevée des nouveaux cas. La répartition détaillée des cas se trouve dans le tableau de bord du GNB. Today, Public Health is reporting 143 new cases of COVID-19 along with 63 recoveries. Sadly, we have another death to report, a person aged 70 to 79 residing in Zone 7, which is the Miramichi region. We have averaged 109 new cases a day over the past week. These new cases are concentrated in and around New Brunswick's 3 largest cities. Again, children and teenagers make up a significant proportion of the new cases, and the full details will be available on the GNB dashboard. We now have 971 active cases of COVID-19 in the province of New Brunswick. Under our winter plan, there are 4 indicators we monitor to determine when a reassessment of public health guidance is required. These include the number of people in hospital and ICU with COVID-19, the increase in the rolling 7-day average of reported new cases, positivity rate of 10% provincially or in any single zone, and the ability of public health to trace contacts. So in the current context, it is hospitalizations and ICU admissions that we are watching most closely. And the number of COVID-19 patients in hospital and ICU admissions have both been trending downward in recent days. There are currently 36 New Brunswickers in hospital with COVID-19, of whom 12 are under intensive care. En date d'aujourd'hui, il y a 36 citoyens du Nouveau-Brunswick qui sont hospitalisés en raison de la COVID-19, dont 12 aux soins intensifs. Le nombre d'hospitalisations est en baisse constante depuis une semaine. Our hospitalizations have been declining steadily over the past week. In Zone 3, which has seen the sharpest rise in cases over the past week, there have been relatively few hospital admissions, currently 5 patients in hospital, with 4 of those in ICU. These numbers are manageable, both for this region and the province as a whole. With the rapid increases in cases in the Fredericton area, there is a backlog of testing that we are working to resolve. There are now 820 tests awaiting completion in Zone 3. We are adding additional staff to process tests, giving priority to those who are showing symptoms and those who have had a positive point-of-care test result. There will be a delay in processing tests for those not showing symptoms, but we hope to address this in the coming days. I ask for your patience while we address this backlog. Il est vrai que notre réaction en réponse aux chiffres annoncés aujourd'hui n'est pas la même qu'elle aurait été il y a 6 mois, mais les choses ont changé depuis. L'hiver dernier, nous avons recommandé le confinement dans plusieurs zones après seulement quelques douzaines de cas. The response we are providing to today's numbers is not what we would have done 6 months ago, but things have changed since then. Last winter, we recommended lockdowns in several zones with only a few dozen cases, but at that time, very few New Brunswickers were vaccinated against COVID-19, and there was no widespread protection against the worst effects of the virus. Since then, the vast majority of New Brunswickers have become fully vaccinated. And we know that these vaccines are protecting people against serious illness, hospitalization, and death. Most people who contract the virus recover quickly, as shown by the number of recoveries that we report. Having a highly vaccinated population allows us to respond differently than we would have done a few months ago. We can now respond in a way that focuses on securing our healthcare system while protecting our collective mental health and well-being. Further restrictions may be required in the weeks ahead as determined by our winter plan, but they will be applied in a manner that recognizes the importance of maintaining as normal a life as possible, as normal as we can have during a pandemic, while enabling our healthcare system to remain functional. COVID-19 remains a risk to New Brunswickers' health, but thanks to vaccinations, it is much lower. Our approach and response to the risk has changed with it, and today, those at greatest risk from COVID-19 are the unvaccinated, as well as older people and those with pre-existing health conditions, and those over the age of 50 who are 6 months from their second dose and who have not received a booster. The largest single group of unvaccinated New Brunswickers are children under the age of 12 who have only recently become eligible for the vaccine. And I'm pleased to report that we are seeing a strong uptake in vaccinations for children, with 22% of this age group having received their first shot. Every New Brunswicker over the age of 50 who has had their second shot in June is now eligible for a booster shot. And I encourage everyone who is eligible to make an appointment through an RHA clinic or a participating pharmacy as soon as possible. For adults who remain unvaccinated, your risk of severe illness is very high compared with other New Brunswickers. Si vous choisissez de ne pas vous faire vacciner, veuillez vous protéger contre cette maladie. Évitez les rassemblements où vous pourriez contracter le virus. Évitez d'entrer en contact avec les personnes vulnérables dont le système immunitaire ne peut les protéger complètement contre ce virus. If you choose to remain unvaccinated, please protect yourself from this disease. Avoid gatherings where you may contract this virus, and avoid contact with vulnerable people whose immune systems may not fully protect them. COVID-19 will be with us for a while. Living with COVID-19 will not be easy after the strains and stresses of the last 20 months, but it is possible. We all possess the skills necessary to slow the spread of this disease and protect ourselves, our families, and our communities. They are the skills we learned in the first weeks of the pandemic. Wash your hands regularly and thoroughly. Cough or sneeze into your sleeve. Wear a mask in public places. Maintain 2 meters of physical distance from others. Avoid crowded gatherings. And outdoor gatherings are safer than indoor gatherings. Stay at home when you don't feel well. And that is something that we're seeing more and more of. I mentioned in an interview this morning with CBC that several times over the last several weeks, there have been social engagements where I've been supposed to participate or others have been planned to participate in, and somebody in their household or they themselves have had some symptoms of COVID and they were awaiting a PCR result. So please continue to get tested if you have symptoms of COVID, and please stay away from social gatherings of any kind if you have symptoms. Get vaccinated and get boosted as soon as you are eligible. Les directives fournies par Santé publique en mars 2020 s'appliquent toujours en décembre 2021. Elles continueront d'être efficaces au cours des mois à venir. Si nous posons tous ces petits gestes tous les jours, ils contribueront ensemble à mieux protéger notre santé et notre bien-être collectif. The public health guidance we gave in March 2020 still stands in December 2021. It will continue to be effective for the months ahead. If we all take these small actions every day, they will add up to better protection of our collective health and well-being. Thank you very much. Merci.
Good afternoon. Bonjour. I know that this is a difficult time for many. Yesterday, we saw the highest one day of new cases since the pandemic began, and today is the second highest one-day number we've seen, with 143. And we're seeing more cases in younger people. 1/3 of new cases reported today are in those under 19. It continues to be something that public health is watching closely. We know children tend to get mild symptoms and recover quickly, but they can carry the virus to other people, and that becomes concerning, especially when it's carried to a vulnerable or unvaccinated person. While the number of active cases is higher, our hospitalizations are going down, and so are admissions to intensive care units. This speaks to our ability to manage this virus, and that is the key. That doesn't mean we don't want the number of cases to come down. We all want to know a small percentage of these cases will likely end up in hospital. Nous avons tout un rôle à jouer pour réduire la transmission communautaire. Much of what is required for making that happen lies with individual New Brunswickers. Government can and has brought in measures to reduce the spread, but it is a collective effort. Mais il s'agit d'un effort collectif. I've seen some messages saying, lock the province down. That would have a short-term impact until we start moving around again, and at the same time cause other issues, such as impacting people's physical, mental, and financial health. Everything we do is about finding a balance so that we can protect our healthcare system and have as normal as life as possible. Toutes nos mesures sont prises en vue de trouver un juste équilibre, soit protéger notre système de soins, de santé tout en vivant une vie aussi normale que possible. These are not big things we are asking people to do. Everyone must follow public health measures, including physical distancing and wearing a mask inside when you are in public spaces and outside in situations where physical distancing isn't possible. Small actions go a long way to reduce the spread of this virus, protecting ourselves, our loved ones, and our communities. It is also important that everyone who is eligible to do so get fully vaccinated as soon as possible, and that everyone get their booster dose once they are eligible. Earlier this week, we opened booster dose appointments to those 50 and older, and we will be expanding that further in the coming weeks. To date, we have administered over 62,000 boosters to New Brunswick. Almost 150,000 individuals are eligible for their booster in the month of December, and approximately another 180,000 people will be eligible for their booster in January. At our peak, we've been able to administer 200,000 doses per month, so we know that we're able to meet this demand. Boosters are available through Horizon and Vitalité Regional Health Authority clinics, as well as clinics at participating pharmacies. The New Brunswick Medical Society has put a call out to members for immunization support, and to date, almost 100 physicians have answered the call. Other professional associations and members are also being asked to help out. We are looking at onboarding nursing and pharmacy students over the holiday break to help at clinics as well. If you're looking to book an appointment, as of yesterday, we had more than 40,000 appointments available at Regional Health Authority clinics in health zones across the province. The only exception is Zone 3, the Fredericton region, where there are not as many appointments, and the regional health authorities are currently working to make additional appointments available. They will also be adding appointment times that the current spots fill. So if you were unable to get an appointment, please check back. There will be more spots available. Regional health authorities are also looking at utilizing community health centers to support immunization of patients. And as well, the extramural program and Ambulance New Brunswick will be partnering to support our pharmacy clinics with additional immunizers. We are doing everything we can to make appointments available to everyone who is eligible to be vaccinated. But we need New Brunswickers to do their part by getting vaccinated, whether you need your first dose, second dose, or booster shot. Each layer of protection we can add, especially with the holiday season fast approaching and opportunities for indoor gatherings increasing, will make a huge difference. Studies show, for example, that in just 7 days after getting a booster, your immunity increases. Truly, getting vaccinated or booking your appointment to do so is the best gift you could give your loved ones, yourself, this holiday season. To help keep everyone informed of how we are doing with administering booster doses, that information is being added to the COVID-19 dashboard today and will be updated daily, just like we update you on the percentage of people who have received their first and second dose of COVID-19 vaccine. As of today, 88.2% of New Brunswickers 5 and older have received their first dose of COVID-19 vaccine. 82.2% have received 2 doses, and 8.4% of eligible individuals have received a booster dose. Everyone, especially parents, have been watching what is happening with schools and childcare facilities with both concern and frustration. I wish there were easy answers, but COVID is changing and we need to change along with it. What that means is, in this case, is that we close schools when it's necessary to do so. We all know that it's better to have children in the classroom rather than learning from home, not just from an educational standpoint, but for their mental health. Unfortunately, there is little predictability about this virus, which is tough on parents and guardians, and it's tough on our children. That doesn't mean we aren't looking for ways to overcome these challenges. Public Health and the Department of Education and Early Childhood Development are working on options to ensure both schools and childcare facilities are able to continue to operate safely throughout the winter months. To help decrease the number of positive cases in schools in the Fredericton region, rapid test kits will be distributed to all kindergarten to grade 8 students beginning Monday, December 13th. In schools with active cases, students and staff will be required to use rapid testing to manage the risk of transmission in schools. In schools which have not had active cases within the past 14 days, it is recommended that students test daily, but it is not mandatory. I understand that parents outside of the Fredericton region are also concerned. I would encourage them to go to a distribution center to pick up test kits so they, if they wish to, are able to do this as well. It's important to remember that the burden does not fall only on the education system. The number of cases we are seeing in schools are often reflective of the number of cases in community. In many cases, students are contracting the virus in a household setting and passing it to a close friend outside of school. Reducing community spread will go a long way to keeping our schools safe. The decisions we make, the actions we take, impact not just us, but the people we live with, work with, go to school with, our loved ones, our neighbors, and our communities. Underneath all the hustle and bustle, I have always considered the holiday season a time to help others in our community. Il y a plusieurs façons d'y arriver, mais je sais que nous pouvons tous obtenir des résultats positifs en respectant les consignes de santé publique. It is simple. It is easy. And by doing so, you are helping to ensure that all New Brunswickers are able to have a safe, happy, healthy holiday season. Thank you. Merci.
Merci, Ministre Shephard et Dr. Russell. Thank you both, Mr. Shephard and Dr. Russell. We'll now proceed with questions from members of the media. Nous allons aux questions des journalistes. Vous avez le droit de poser votre question dans la langue officielle de votre choix. You have the right to pose your question in the official language of your choice. Chaque journaliste aura une question et un suivi très, très rapide, s'il vous plaît. Each reporter will have one question and the quickest follow-up. We are going to start. On va commencer avec Maria Isabelle Noël de Radio-Canada.
Oui, bonjour. Donc, ma question, quel est votre plan pour les patients dont les médecins non vaccinés ont vu leur permis d'exercice suspendu?
So not unlike the situations when we lose a family physician due to retirement or moving, patients will be able to access 811 so that we can hopefully meet any urgent needs that they have. And then to the Patient Connect list. And as you know, during our health plan, we revealed the patient, the primary care network, which is being developed and will only be into February before that is beginning to be implemented. So we know that this is not an ideal situation. The MBMS and the College of Physicians and Surgeons have supported this process, and we understand the inconvenience and will work diligently to try to minimize it.
Mademoiselle Noël, as-tu un suivi cet après-midi?
Oui, s'il vous plaît, j'aurais un suivi pour le docteur Shephard. Quand est-ce que la mesure de suspension des médecins non vaccinés sera levée?
I don't see it being removed in the near future. I can't answer that question. It's not something that's being discussed right now. Again, the College of Physicians and Surgeons would probably likely better answer that question.
Merci.
Merci beaucoup. Ailish Bonang, CTV.
Hi, Bruce. Can you hear me?
Yes, thank you.
Okay, my question could be for either Dr. Russell or Minister Shephard. As you've both mentioned today that the case numbers in hospital are manageable. A doctor who spoke today actually during the Horizon Health quarterly board meeting commented on how, things like the pandemic and COVID positive patients and the vaccination mandates for staff have in fact impacted their ability to provide services and the level of care that they would like to. With the current outbreaks within the hospitals and hearing from people, with boots on the ground saying that they are struggling, why are further steps not being taken to provide them help, such as moving to a more restrictive level?
So again, we rely on all of this information to come from our CEOs of the RHAs and their VPs, the CEO of Extramural and Ambulance New Brunswick, and Public Health. All of this information is brought together, and decisions on paths forward are moved together. If the RHAs are struggling, again, I've mentioned this before, the Premier and I meet with the RHA CEOs twice a week. And should they be asking us to take extra measures, it certainly would be considered in with the public health recommendations. At this time, I'm not aware that we've been asked to do anything more.
Ms. Bonang, do you have a follow-up, a quick one?
I do, yeah. So what specifically is the province doing in order to help with the current outbreaks at the hospitals across the region?
So the management of the RHAs is really in the hands of the RHAs, and if they need additional support with regards to anything specific, our department certainly is willing and has in the past helped. In fact, when our hospitalization cases peaked, 7 or 8 weeks ago, we implemented a committee which helped manage and put together a provincially scoped system to help manage ICUs province-wide. So we can come to the table with whatever their needs are when the requests are made.
Thank you.
Is that committee still active?
Yeah, when it needs to be. Right now, the ICUs are very manageable.
I'm going to go to Vicki Hogarth.
Thank you.
CHCO.
Thank you, Bruce. My question is for Dr. Russell or Minister Shephard. We've heard from a handful of New Brunswickers this week who've taken advantage of loosened border restrictions with the U.S. and have gone to Maine for a few hours, only to be turned away from doctor's appointments as well as some scheduled blood work and x-rays for the following 2 weeks after they've returned. Can you clarify what our policy is, even for short trips to the U.S. with regards to appointments with doctors? Is it 2 weeks that you have to wait, even if you've gone for a few hours?
Well, I'm really going to have to refer you to the RHAs on this because they do have posted on their website a list of questions that are being asked for anyone who shows up at the hospitals, whether it be for testing or for an urgent matter. And so it's really important, one, that if you have an urgent issue that you go to the hospital. They are prepared to take care of you. But two, if your travel brings forward a risk and they deem that your procedure can be postponed, it's really in their hands. This is their hospitals to run, and they need to do it for the protection of everyone.
Ms. Hogarth, do you have a follow-up?
I do. Thank you, Minister Shephard. My follow-up is for Dr. Russell. Canada has signed purchase agreements with both Pfizer and Merck for antiviral pills that are currently under review by Health Canada for their ability to reduce symptoms of COVID-19 in those infected with the virus. What do we know about these pills right now, and how likely will they be used in the near future in hospitals, and how promising are they?
My understanding is that they are promising, but that they wouldn't necessarily be able to be used for about 6 months from now, is the information that I was given.
Thank you. Thank you both. Pascal Rochenag, Radio-Canada.
Bonjour, ma question est pour la docteure Russell ou pour la ministre, peu importe. Donc, vous dites dans le fond que les hospitalisations, c'est ce qui est très important et qu'en ce moment, les hospitalisations sont à la baisse, que c'est possible de gérer le nombre d'hospitalisations. Mais avec 174 cas hier, 143 aujourd'hui, vous n'avez pas peur que dans 2, 3, quelques jours, peut-être une semaine, que les hospitalisations remontent en flèche? Donc, est-ce que vous craignez une hausse des hospitalisations dans les prochains jours?
Oui, je vais commencer avec la réponse et si le ministre Shephard veut continuer, je vais passer la parole à elle après, à la suite. On a des discussions sur les nombres de cas et comment on peut prévenir le nombre de cas qui nécessiteront une admission à l'hôpital dans les prochains jours. Le positif au sujet des nombres de cas qu'on a maintenant, c'est que c'est vraiment la majorité, c'est dans les plus jeunes, et on sait que les plus jeunes n'ont pas besoin d'être hospitalisés. On sait aussi que les gens qui sont doublement vaccinés à ce moment-ci ont un risque plus bas d'être hospitalisés. Alors, la seule chose que je peux vous dire est on regarde les moyennes durant un moyenne de 7 jours, et quand que ça commence à baisser, ça c'est la direction qu'on veut voir. Est-ce que ça peut remonter? Oui, mais basé sur l'information aujourd'hui, on peut pas vraiment dire oui ou non ça va arriver. On espère que non. Mais basé sur les âges des cas positifs et le pourcentage qui sont vaccinés, on espère qu'on va continuer à avoir les nombres de cas hospitalisés continuer à diminuer.
Monsieur Rachnag, as-tu suivi?
Un suivi rapide sur la question de l'ouverture des écoles. L'opposition officielle aujourd'hui a demandé à la santé publique de considérer ou d'évaluer sérieusement la possibilité de peut-être soit fermer les écoles quelques jours ou de prolonger le congé du temps des fêtes pour permettre à la transmission de baisser au Nouveau-Brunswick dans les écoles. Est-ce que c'est une possibilité qui est évaluée en ce moment?
Le ministre Shephard va ajouter. À ce moment-ci, le travail qui est fait avec les écoles, avec la santé publique, c'est vraiment pour garder les écoles ouvertes. Sauf que c'est une situation où ça nécessite la fermeture d'une école, c'est ça qui va être fait. Mais faire une fermeture avec toutes les écoles, c'est pas quelque chose qu'on discute à ce moment-ci. On sait que nos collègues dans d'autres provinces, même dans les derniers jours, disent que c'est très important de garder les enfants à l'école le plus que possible et en même temps éviter des hospitalisations. Alors, ça continue à être notre but, avoir la capacité d'avoir les gens, avoir la possibilité d'aller à l'école, d'aller au travail, en même temps que essayer de continuer à diminuer le nombre de cas qui sont hospitalisés.
I'm just going to echo what Dr. Russell has said, and as she's indicated, her colleagues in Ottawa, the Minister of Health in Quebec, we're all singing from the same song sheet. We are, we are talking about how living with COVID is going to be different. But we know that the priority is keeping our schools open and keeping our hospitals safe and operational.
Merci à vous trois. Merci, Monsieur Rachnag. On va passer. We're now going to go to Adam Hears with Brunswick News.
Thanks, Bruce. Question for you both. You both cited that hospitalizations are low, but doesn't a spike in cases to the level we're seeing now just mean that an increase in hospitalizations might come in a week or so?
Speaking with my team yesterday about that in terms of modeling and predictability and finding out the situation right now in terms of all the cases that have been recently admitted, what day during their illness did they get admitted, how far into their diagnosis, testing positive for COVID, did they then end up in the hospital after that? We know that certainly for unvaccinated folks, sometimes their first symptom, they don't seek help or testing right away. We have seen situations where some individuals present to the emergency department with quite severe symptoms requiring admission right away. So there's quite a variation of presentations and timelines. So I did ask my team to look into that in terms of trying to quantify based on the number of cases, based on the ages, based on the vaccination of the cases, what that translates into. And so they're going to look into that for me.
I will just add, Adam, because we rely so much on the epidemiological team at Public Health, and they have been quite stellar throughout the last 22 months in helping us make decisions. And there is so much that goes into it. The number of cases that are young, the number of cases throughout that are vaccinated and unvaccinated, those age groups. So it is something that they watch and report on every single day. So we need that. We need that kind of monitoring, and it's invaluable to us as we go forward in making these decisions.
Thank you both. Mr. Hirsch, do you have a follow-up today?
Yes, please, Bruce. I'd just like to know why you didn't find it appropriate to call a press conference yesterday when the province recorded the highest number of COVID cases it's had in a single day. There's just been a lot of criticism of that, I guess both inside the legislature and from New Brunswickers today. I wanted to give you the opportunity to address that.
Well, I've been battling a cold all week, and Dr. Russell was actually on vacation. But what I mean by this, Adam, is that we know that people react to the numbers, and I hear what you're saying. But without putting everything in context, without making sure that we had the message that we could convey confidently, you don't call a press conference. And so we knew that today we wanted to come out. We wanted to bring the information that we could put together. And it isn't about jumping out there to give people anecdotal information to try to put them at ease. This is about getting the facts together, making sure that we understand what we're dealing with, and then having those conferences to ensure that we're on the right path and that we're making the best decision on any given day, and that's today. So we're going into the weekend. It makes sense to give people the most up-to-date information today. Chances are there won't be another press conference until next week, and so it's logistics really that work with all of this, and there's many components to it.
Thank you.
I would just add that I agree with Minister Shephard that context is extremely important. So when we look at those numbers, yes, it's high, yes, it's record-breaking, and yes, it's very concerning, but we have to look underneath those numbers in terms of the context, what it means, how to frame the risks properly, and how to identify which things are necessary to address all of those risks.
Thank you. Travis Fortnum, Global TV.
Hi there. My question is for Dr. Russell. With the high case counts that we've been hearing about among youth, I'm wondering if we know what's contributing to that spread, or where these kids are catching the virus, and what can or is being done to stop that particular spread.
My understanding is that there's quite a variety of ways that transmission is happening. So I don't think we can say that it's exactly in one type of setting or another. Certainly the transmission pattern that keeps recurring is within households for sure, that once somebody is infected within a household, members of that household then can bring it to either their workplace or to the school setting or activities or social functions.
Fortnum, do you have a follow-up today?
Yes, thanks. Also for Dr. Russell, we heard Minister Shephard say lockdowns at this point would only be a short-term solution, with spread spiking back up when they lifted. I'm wondering if you agree with that, if lockdowns are ineffective.
Well, I'm going to start because I didn't say lockdowns were ineffective, but we are transitioning at a time of COVID to living with COVID. And lockdowns need to prevent our hospital systems from crashing. And so it's more complex than that. If we just want to lock down for the sake of locking down, to bring our cases down, what are the impacts of that socially, financially, mentally? And so all of these things matter. It is about finding that balance that allows us to live our life with COVID and protect our schools, protect our hospitals, and keep people well.
Thank you. Callum Smith, Global. Laura Brown, CTV.
Hi there. I'm wondering what you would say to parents who are at this point making the decision to pull their children out of school until the new year.
So we have closed schools that needed to be closed. And we've made the decision that we want to keep children in school as much as possible. Parents need to work. Children need a safe place to be. And it doesn't mean that there's zero risk to contracting COVID. But we take action in the schools that we need to close. We are trying to be proactive in making sure that point-of-care tests are available to empower families to test themselves and to see what kind of position they could be in. And so it's everyone needs to make their decisions. We're going to do as many proactive things as we can with regards to, the public health measures we're looking to support. And it's not just school that some people may choose not to send children to. It could be a Christmas gathering that they turn down. It could be, holiday parties that they decide they're not going to attend. It could be not shopping at the mall when it's the busiest time of the week. It could be, getting your groceries at early in the morning before it's busy. Those are the kind of decisions that go a long way to helping us combat the transmission of COVID.
Ms. Brown, do you have a follow-up?
Yeah, I want, Dr. Russell, I'm wondering a comment from you on something David Kuhn said today during scrums with reporters. He said he's hearing the same narrative coming from our Chief Medical Officer of Health that's also coming from our politicians. He's concerned about the decision that is being made internally at GNB versus public health. Do you agree that we shouldn't be doing restrictions at this point, or bringing in some sort of a more creative way, I guess, to bring down the cases?
So I fully support the winter plan. Public health fully supports the winter plan. Our input and contribution to what is happening right now with respect to the criteria for having risk assessments and discussions. Again, how things get communicated with respect to a policy decision, I do feel is part of the government's responsibility. From a public health perspective, I've always supported the idea that, when it comes to explaining the science behind policy decisions, I'm happy to do that. At the end of the day, the collaboration, again, with public health right now on the winter plan, fully supportive of this winter plan at this time.
Can I just add to that? I'm going to pull something from the updated COVID-19 report from the Public Health Agency of Canada. And it's on page 13, and it talks about the challenges that we're facing. And I think this is really important. So I'm going to take my liberty here and take a minute to read this. Despite the challenges ahead, we have more and better protections going into this holiday and winter season than previous. Canada's approved vaccines provide substantial protection to dampen the severity of the virus, and improved layers of protection can reduce the risk of infection and spread in our homes and community settings. Regardless of our vaccination status, we can still be safer over the holidays by keeping up with public health advice as the situation evolves, and using the best available layers of protection, particularly if indoors with others outside our immediate household, including wearing a well-constructed and well-fitting face mask, keep gathering sizes small, improve ventilation, maintain hand and cough hygiene, stay home and away from others in the event of any symptoms, get tested, especially if symptomatic or as recommended. These are all the same things we are saying. We are not saying anything different than Public Health Agency of Canada and our partners across the country.
Thank you both. Bobby Jean McKinnon with CBC.
Can you hear me?
A little louder to your microphone, Ms. McKinnon.
I'm sorry, can you hear me now?
Yes, thank you.
Yes, Dr. Russell, do you support the 5-month booster timeline, and was it based on your advice?
The issue around the 6-month, that's a NACI recommendation. We fully support NACI recommendations from a public health perspective. There's no question. But the caveat with all of NACI recommendations, that is, there is flexibility for all jurisdictions to make decisions based on their own jurisdictions, epidemiology, et cetera, and risks. So for that reason, allowing people to go slightly ahead, earlier than the 6 months, the goal really was about not cutting somebody off who might be a week away from that 6-month mark in terms of, operationalizing that in the system. So we're comfortable with that guidance right now, again, in the context that we fully support NACI recommendations, knowing that each jurisdiction has the flexibility to make decisions based on their own epidemiology and their own situation in their province.
Ms. McKinnon, do you have a follow-up? Do you have a follow-up, and a little louder, please?
I'm sorry, my question was actually, do you support the 5-month booster timeline, and was it based on your advice?
So Bobby Jean, I hear what you're saying, and again, from a logistics and operational perspective, NACI recommendations need to be contextualized within each jurisdiction.
Do you have a follow-up, Ms. McKinnon?
Well, I still don't feel I've gotten an answer to that question. But
well, she did answer it, so could we move to your next one?
I guess, Mr. Shephard, you and the Premier and Dr. Russell have all said that we've got to learn to live with COVID, but we have to live with the case count this high. I mean, if we look at Nova Scotia by comparison, it has only 194 active cases. So why is their case count so low, and what more could we be doing to reduce our cases?
Well, I think that's what the winter plan is all about, and it's helping people to understand if they take simple measures, we can bring this case count down. In fact, I was pretty emphatic asking our epidemiological team if they felt the winter plan would bring our cases down, and they emphatically answered yes, because we do have these robust conversations and challenge data. There's been times when public health has talked me off the wall in wanting to do things that they felt just weren't warranted. So we all have our nervous moments when we think, are we doing this right? And again, I go back to the fact that we make the best decisions with the best information on any given day. And so I can't explain to you why Nova Scotia's cases are lower. I can tell you that we have protected Nova Scotia and PEI in the past. We could be doing that again. We could be taking the hits where they're not. But that's anecdotal. I can't prove that. So I can't really tell you why Nova Scotia is doing better than us. But what I can say is that we feel that if the public participates and helps with this, just like they have been doing and they're going to continue to do. But we need to be extra diligent over this coming holiday season and in through the winter months.
Thank you. Justin Dupuis, l'Acadie Nouvelle.
Oui, merci Bruce. Je voudrais savoir, vous avez mentionné tout à l'heure que vous surveillez de très près le nombre d'hospitalisations. Je voulais juste... Est-ce que ça veut dire que c'est le nombre d'hospitalisations qui vont éventuellement justifier des mesures plus sévères, ou est-ce que si on continue d'observer un nombre de cas quotidiens aussi élevé que dans les 2 derniers jours, que ça aussi, ça pourrait justifier l'adoption de mesures plus strictes?
Alors, il y a un grand total de 4 critères qu'on va examiner chaque fois pour décider s'il y a de quoi qu'on devrait changer. Alors, à ce moment-ci, celui qui est le plus important, c'est le nombre de cas hospitalisés et dans les soins intensifs.
Monsieur Dupuis, as-tu une suivi?
Oui, je voudrais savoir, depuis plusieurs mois déjà, lorsqu'on parle des décès associés à la COVID, en fait, je vais reformuler ma question. Au début de la pandémie, lorsqu'il y avait des décès associés à la COVID, la province ou la santé publique prenait toujours le soin de mentionner que, que ces décès-là étaient associés à des problèmes de santé sous-jacents ou des comorbidités. Depuis plusieurs mois, on ne fait plus référence à ça. Puis je voudrais savoir si, depuis la levée des restrictions cet été, si c'est toujours le cas. Est-ce que la majorité des décès sont associés à des problèmes de santé sous-jacents?
I don't know that we would have that data here today. I think I can say confidently that, you know, a number of our COVID-related deaths, which are always tragic, usually have underlying complications with them, depending on the age and depending on you know, on their medical history, which we don't really get into here. So I'm not sure if we, you know, I don't think we've ever stopped. It's just, I guess we've always assumed that most people would have something underlying that causes COVID to, you know, to unfortunately give them difficulties they can't overcome.
Merci beaucoup.
Si vous avez ces données-là, est-ce que vous pourriez me les envoyer?
If we have them, we'll get comms to check for you.
Merci.
Merci, M. Dupuis. Merci, Ministre. Erica Butler with CHMA Sackville.
Hi there. Thanks, Bruce. I have a question for Minister Shephard. As I'm sure you're aware, there were protests this week outside the Sackville Hospital in response to service cuts by Horizon, which were precipitated by a lack of available nurses. The concerns here are twofold. One, that the plan to close down services at rural hospitals is still alive and well in the Department of Health. And two, that there doesn't seem to be any solutions on offer to address the lack of available nurses here and elsewhere in New Brunswick. I'm wondering if you can speak to those concerns.
Sure. Look, we've made a commitment to rural health care in the health plan that we just brought forward. The situation in Sackville is about availability of human resources. And we know, in fact, I spoke to this before the summer. I said that this situation would get worse before it gets better. We're dealing with longstanding issues that have never really been addressed, and they go back many years. And so we know that that we have recruitment and retention programs that are implemented now that we will be enhancing in the weeks coming forward, and that's our only way out of this. We have got to get the personnel that we can to deliver the programs that we have there, but it is certainly not an attack on rural hospitals. It is a human resource issue, and we are fully committed to our rural hospitals throughout New Brunswick, as I've stated several times during my health plan unveiling.
Ms. Butler, do you have a follow-up?
I do. I have a follow-up for Dr. Russell. I had a question about contact tracing and the resources that we put towards it. And I'm wondering, when something happens, like a daily case count nearly doubling, as they did Thursday, how does public health respond in terms of resources there? Do we have additional contact tracers that can come on board at that time, or do we just get farther behind when cases spike like this?
Well, a couple of things. We've been evolving, as we always need to evolve during this pandemic, from the resources that we actually utilize, whether it's accessing our public health nurses from other programs, such and that they would have been working on separate from COVID. So pulling those resources in, doing more shift work in terms of how to staff the teams. Also, we use the StatsCan staff as well. So, but mostly it's pulling people away from work that was non-COVID and to staff up the teams that are doing the contact tracing. But those are the biggest changes that happen.
Thank you, Ms. Butler. Thank you, Dr. Marie Sutherland with CBC.
Me?
Little louder, Ms. Sutherland.
For Minister Shephard. Can you hear me? Sorry.
Yes, thank you.
Okay. Minister Shephard, another contact tracing question. You said this morning that the province probably won't be able to continue contact tracing for every single case. How long is it taking for contact tracing, for contact tracers to contact people now, and how close is the province to reaching a point where it'll have to stop contact tracing?
Well, I think my words were we probably at some point won't be able to get every single case traced. And I at least that was my intent. We are still contact tracing now. While not everything is being done in as timely a manner as we'd like, that is still being, that process is still ongoing and will continue to go on as long as we can. And we put considerable resources to it. If we believe that there are more resources that are needed, we would do that. But part of our evolution into living with COVID will be an understanding that we're always going to have some cases. And it's about managing, it's about, getting our population vaccination rate up high so that those who do contract COVID, have less opportunity for serious illness, hospitalization, ICU admissions, and/or death. And I think that that's really got to be the goal. But contact tracing is ongoing and will continue to ongo.
Ms. Sutherland, do you have a follow-up?
I do. A question for Dr. Russell. Federal modeling shows Omicron could supercharge daily COVID case counts in Canada in the coming weeks. What are the projections here for new cases, hospitalizations, ICU admissions, and deaths after Christmas?
Well, we just received that modeling information at the national level today, so I took a look at that. In terms of modeling moving forward, I'm not sure what the status is of that modeling at this moment in time. So, but safe to say that the national modeling is pretty accurate in terms of what it's predicting at this moment in time. So, with that in mind, it's not a great picture that's being painted. Certainly it does highlight the risks and what it is that we need to do to continue to mitigate those risks. So we will definitely use that modeling and our epidemiology team will be using it.
Thank you. Thank you both. To Travis Fortnum, Dr. Russell has some more information to one of your questions. No, you have the...
Oh, sorry, Travis. Sorry. I thought Travis was going to ask another question, but I'm answering a question that Travis already asked. Now I get
more information.
Yes. So you were asking about transmission with respect to schools and school-aged children. So with respect to school-aged children, we're definitely seeing transmission in schools as one part of it. We're seeing exposures in sports. And obviously the best advice, is to try to keep everyone's close contacts as small as possible. Minister Shephard was not wrong in suggesting that, people can make choices about what activities they participate in, whether it's a gathering, a social gathering, etc. And then just coming back to Laura's question around keeping kids home, as we keep saying, we're going to be living with COVID for a while. We're just talking about the projections with Omicron, and knowing that children under the age of 12 can't be fully vaccinated, until probably February if you count the timelines in between. So the risks are going to keep evolving. We're going to keep evolving with the risks. The challenge of keeping your kids home right now is that, well, when is a good time then to have your kids be in school with things that are going to continue to evolve and change and risks that are going to continue to evolve and change. So how we're managing right now in terms of the way that schools operate and school activities and sports and clubs and teams, again, we've tried to make them as safe as possible, knowing that the risk will never be zero. And again, offsetting that with the need for children to have an education, the mental health aspects around being in school, et cetera. So balancing all of those things right now as we continue to evolve with COVID-19.
Thank you. Merci, Ms. Shephard. Merci, Dr. Russell. Thank you both. That concludes today's update. Voilà la fin de notre mise à jour. Thank you very much.